Hi, I'm Sarah. I'm the moderator for the group. The topic we will be debating is experimental functional analysis versus descriptive analog functional assessment. For this assignment, the prompt we were given is experimental functional analysis is considered the gold standard in ABA. However, IDEA 2004 mandates that functional behavioral assessments be conducted to address maladaptive behaviors in schools. While research confirms the importance of experimental functional analysis in developing treatment interventions for individuals with severe injurious behaviors, others argue that less intrusive, less expensive assessment procedures are as effective in identifying target behaviors and identifying the controlling environmental variables associated with severe behavior. For the experimental functional analysis, we have Jessica Baird, myself, and Jade. For the descriptive analog functional behavior assessment, we have Carly and Jenica. First up, we have FBA Stater, who is Jenica.
Hello. So I'm the stater for the descriptive and analog functional behavior assessment side of this debate. We are here to discuss why the FBA is a more direct observation of behavior, unlike functional analysis observations, and are made naturally with occurring conditions. An FBA is a process comprised of many components that helps identify specific target behaviors and their purpose. The process will then lead to a development of a behavior intervention plan. With taking FBA data, there are observations of the problem behaviors taken into account with events that are not arranged in a systematic manner. It is very unlikely that any two FBAs will appear to be the same. FBAs can increase the likelihood of reinforcement-based interventions rather than interventions that include a punishment. Functional behavior assessments plays a vital role in their intervention and prevention. The FBA has the ability to identify an effective and efficient intervention by identifying the following: antecedent variables that can be altered to prevent the problem behaviors that are being observed. It can also identify the appropriate reinforcement in which can alter the problem behavior from occurring. And lastly, it can identify appropriate reinforcers to redirect the problem behavior using the alternative risk placement behaviors. FA and FBA strategies were evaluated by Mitchell in a comparison of functional and behavior assessments and functional analysis methodologies among students with mild disabilities. The purpose of this study was to look at both methodologies, and with this, they were able to see that common FBA practices along with hypotheses derived from FA trials were similar in results. Table 2 shows that the majority of FBA summaries were confirmed through the FA trials when both primary and secondary hypotheses were considered. These results help support the idea that FBAs can produce useful information. We will now be discussing the following points: the advantages and the disadvantages of FBAs and technological advancements, in addition to economic and societal political factors, and regarding FBAs. Thank you.
Thank you, Jenica. Now we will have the FA Stater, who is Jade.
First and foremost, I would like to state point by point why the experimental functional analysis assessments are a more beneficial model of assessment compared to the functional behavioral assessments in ABA. Experimental functional analysis is conducted by personally exposing the individuals to various stimuli to determine what specifically causes the behavior. Functional analysis looks at 4 areas: attention, escape, avoidance, sensory, and tangibles. These areas help the behavior specifically point out what causes the behavior, as opposed to FBAs being conducted in the opposite way. Much research has proven that experimental functional analysis is the golden standard in ABA. With that being said, the upcoming debate points will be touched upon in regards to research that support the results of experimental functional analysis versus functional behavioral assessments that further include the advantages of experimental functional analysis, the effectiveness of FAs versus FBAs, and more specifically touching upon the importance of developing treatment interventions for individuals successfully with severe injurious behaviors and those with non-injurious behaviors. And lastly, how functional analysis collect more reliable data and conclude greater results. Thank you.
Mike.
And next we will hear from the FBA prover, who is Carly.
So I'm going to be talking about some of the pros of the descriptive, analog, and functional behavioral assessment side. Research has been proven to show that FBAs are useful, crucial, and beneficial in many different instances. It is a critical tool for developing effective behavior interventions/support plans. Descriptive methods establish a correlation between the behavior and antecedent or consequent variables, whereas a functional analysis identifies causal relationships. A variety of techniques are used to understand what's behind inappropriate behaviors. This includes looking at non-academic factors that might be contributing to your child's frustration with learning. The major advantage of this methodology compared to other methods of functional assessment is that it allows greater control over the environment, resulting in a more direct inference of functional relations. In contrast to the analog functional analysis, descriptive assessments involve direct observation of behavior and events in the individual's natural environment and involve less control over environmental variables. Descriptive assessments may yield information about naturally occurring schedules of reinforcement and idiosyncratic variables associated with problem behavior. Recent research suggests that descriptive assessments may be beneficial in augmenting analog functional analysis. For example, hypotheses about environment-behavior relations might be developed via descriptive assessment when results of an analog functional analysis are inconclusive. Descriptive assessments also may be useful when it is difficult or impossible to conduct analog functional analyses. In recent years, rather than being used to assess the potential function of a response, descriptive assessment methods have been applied to evaluate potential consequences or contingencies for problem behavior. In a journal article comparing a descriptive and functional analysis of inappropriate mealtime behavior, the research showed that the relatively high correspondence for attention and escape functions suggested that descriptive assessments may be a viable alternative to functional analyses, and future research should evaluate the effectiveness interventions based solely on descriptive assessments. This is an encouraging finding for practitioners, as many may not be in the position to conduct functional analyses of IMB in less intensive settings, but these results suggest a reasonable alternative to a functional analysis, and additional information can be gained from descriptive assessments that might not be available via functional analyses. For 7 of the 10 participants, no bites of food were consumed during the functional analyses, making it impossible to identify any child responses following food acceptance. However, some bites were consumed during the caregiver-fed meals, and the descriptive assessment allowed them to gather information not available via functional analyses. Descriptive assessment methods may allow practitioners to gather useful information about having to expose such a behavior, such as gagging, to a functional analysis. For many practitioners, descriptive assessments are commonly used in less intensive settings, such as schools or in-home therapy, and data shows that descriptive assessments may be a reasonable, practitioner-friendly alternative to a functional analysis. They are also convenient to use, cost very little to complete, and do not disrupt the person's daily routine. The information gathered from these methods can help to identify hypotheses about the functions of the behaviors. It can help identify specific patterns in the behaviors, such as times of the day that the behaviors occur. Other patterns might involve specific environments, teachers, peers, or tasks that typically trigger the behavior. Thank you.
Very good job, Carly. And now I am the FA prover. So an advantage of the experimental functional analysis compared to an FBA is you can identify a functional relation without any questions. In contrast to the FA, when using an FBA, you do not have a clear functional relation. As a therapist, I would want to determine the function of the behavior, and I would want to know the functional relation. Providing an experimental functional analysis would provide a clear functional relation. Functional behavior assessment and functional analysis states the main advantage of FA is its ability to reliably identify the variable that relate to problematic behaviors. In the behavior analytic community, it is the gold standard by which other assessment alternatives are evaluated against. Identifying variables to figure out the function of behavior is very important. If you are not able to identify the variables, then you are not able to have a clear understanding of what the function of the behavior would be. Applied behavior strategies states experimental functional analysis is a manipulation of events to prove why the behavior is happening. When conducting an FBA, there is no way to prove why the behavior is happening. As therapists or behavior consultants, we can make a hypothesis as to why the behavior is happening, but conducting an FBA doesn't prove why the behavior is happening. It provides a standard of scientific evidence by which other assessment alternatives are evaluated and represent the method most often used in research on the assessment and treatment of problem behavior, stated by Cooper, Heron, and Heward. Enabled the development of effective reinforcement-based treatments and less reliance on punishment procedures, also stated by Cooper, Heron, and Heward. And now we will hear from the FBA attacker, who is Jenica.
So you do make very great points. There are so many ways that an FBA can collect enough information on the client to hypothesize an intervention for the behavior. There are also many things that a FBA can collect, such as narrative recordings, scatter plots, recordings, and sequence analysis, which is the ABC data that is being collected, all of which contributes to trying to identify the probable cause. The article you referenced talked about both functional behavior assessments and functional analysis. With this data, they even state that functional behavior assessments is a method that is easy and convenient to use, costs very little, in addition to not interfering with the client's daily routine. With an FBA, there is information that is collected that can help hypothesize the functions of these behaviors. They even state in the article that a functional analysis takes quite a lot of time and effort and isn't always cost efficient, as they need professional expertise in order to even complete the assessment. The article you referenced also states that the descriptive assessment has the ability to collect enough information to address the functions of behaviors. When you look at skills needed in order to interpret a FBA, this is something that can be taught. Bogermeyer in 2015 demonstrated that the minimal targeted professional development is needed in order to evaluate these assessments. The majority of educators participating in their study were able to identify the same function of the problem behavior as experts. Other research has demonstrated that teachers from CAMS, Windland, and Culper-Pepper in 2006, and school support personnel such as paraprofessionals can accurately complete FBAs with appropriate supports and guidance. With that being said, FBAs overall are more cost efficient and can be just as effective and can be done by those individuals working with the client with proper training. They can collect enough data to come up with similar results.
Thank you, Jenica. And now we will hear from the FA attacker, who is Jessica.
The FBA side has certainly made some great points, and there are a lot of advantages to using descriptive assessments. However, descriptive assessments are often prone to false positives. Because there is no empirically based data taken, behavior analysts look for correlations between antecedents and consequences. Oftentimes, antecedents and consequent behaviors are present, but the maladaptive behavior is absent. Also, some correlations are determined by the setting. Some settings evoke certain behaviors while others do not. This is not reliable. The FBA side stated that oftentimes results of functional analysis are inconclusive. If the results in functional analysis are inconclusive, this still can give us a lot of information about the behavior. The function of the behavior can be multifunctional. Inconclusive results could also mean a variable was present in each of the conditions, or the behavior's function is automatic. If the behavior is automatic, we would expect the behavior to be slightly lower in the demand condition. This is due to the principle of differential reinforcement of incompatible behavior. If we are presenting demands, one cannot engage in maladaptive behavior. Though the data is inconclusive, we can still learn a lot about a behavior, and it is still time efficient. Functional analyses are more accurate than descriptive assessments. The study referenced has many flaws. In the study, it said they used a variety of non-preferred and preferred foods at mealtimes, as well as novel foods. It has been proven through stimulus preference assessments, such as free operant observations and trial-based methods, that just because something was empirically proven to be a preferred item does not mean an item would be reinforcing. My next point is how often were the preferred food items given. My preferred food items change on a daily basis. If the child had previously had access to this preferred food item, there is the possibility that the client could be saturated on that food, especially since all foods present in the descriptive assessment were present in the functional analysis. Another confounding factor to this study is sequence effects. The descriptive assessment was conducted first, followed by the functional analysis. The previous conditions and sessions could have impacted the results of the study. Iwata has conducted two different studies, one in 1993 and one in 2007, and reported that low levels of correspondence between descriptive assessments and functional analysis. This demonstrates reliability because this study has been replicated. The study mentioned previously has not been tested or replicated. Replication is the key to science. It is also one of the 7 dimensions of ABA. Look at the study that reported vaccines cause autism. The study was fabricated and has not been replicated. To this day, we are still battling whether vaccines cause autism. The study itself even says one potential limitation is that it is not clear if descriptive assessments are sufficient to thoroughly assess the functions of IMB and prescribe effective treatment. The study continues to say a descriptive assessment may help behavior analysts to effective with treatment. It's still not clear what the most efficient method is. Though an FA can be time-consuming, it is more accurate because it is empirically based. Thank you.
Thank you, Jessica. And now we will hear summary statements from Jade.
So I am going to share 2 graphs from an article that I found. So in the first graph, well, the article is reviewing a behavioral assessment process from descriptive assessments to experimental analysis. So this first graph is an example of functional analysis, what a line graph would look like. So our 4 areas that functional analysis does look at are escape, attention, tangible, and sensory. So this is what this graph is showing. And the graph provides an analysis of experimental functional analysis procedures for clients from across the board in a large sample size. So these graphs were out of 118 cases. And then this next graph in figure 4 focuses on aberrant behavior and the number of MANs shown. So the 3 manipulative MANs were free play and with the aberrant behavior. And this study employs the use of functional analysis for the development of treatment based on the function of it. So as you can see, it starts out decreasing, it increases again, decreases, and then by the end of it, it does end up increasing. So those are the two figures. And okay, cool. So for the functional analysis summary, functional analysis has been proven to be more effective in several other studies. Because functional analysis involves experimental manipulation, they provide the most accurate functional relation between behavior and its environment. Functional analysis has the ability to reliably identify the variables that relate to problematic behaviors. In the behavior analytic community, it is the golden standard by which other assessments alternatives are evaluated against. Experimental functional analysis is a manipulation of events to prove why the behavior is occurring. When conducting an FBA, there is no way to prove why the behavior is occurring. That is why functional analysis is the most reliable assessment that should be conducted. Thank you.
Thank you, Jade. And now we will hear from Jenica, who will give her summary statements for the FBA side.
So as we discussed a little bit earlier, with FBAs, there are of course many advantages. We are able to identify contingencies within the natural setting for the individual being observed. There are direct observations. There is narrative recordings, pattern analysis that are being conducted, sequence analysis, which is your ABC recording, as well as conditional probability analysis. Of course, with advantages, there are a few disadvantages. Interpretation of data collected from descriptive assessments. It can be biased or unreliable when correlations provided. But with that, there is a lot of research that we have seen that FBAs are convenient, they're cost efficient, and they do not burden the person's day-to-day routine. The information gathered from these methods can help identify hypotheses about the functions of behaviors. It can identify patterns in the behaviors occurring that can help come up with our behavior intervention plan. Many practitioners found efficient use in descriptive assessments, which are commonly used in less intensive settings such as schools and in-home therapy. As research has shown, there are teachers and school support professionals such as paraprofessionals. They were able to accurately complete FBAs with appropriate support and guidance. The data shows that descriptive assessments may be a reasonable and practitioner-friendly alternative to functional analysis. Thank you.
Thank you, Jenna. And now we have a few questions from our audience. So question 1 is, how could you respond ethically to a coworker who is a BCBA and is frustrated the principal of the school she consults in will not permit her to conduct an FA?
In this type of situation, I would just encourage the BCBA to still advise the principal for them to be aware of the importance of the analysis, and for the colleagues to ensure that they explain to the principal how the functional analysis would impact on various parties that are involved. It not only affects the client, whoever needs the assessment. Additionally, the colleague should assure the principal of confidentiality to ensure that they are at ease with the functional analysis, to make sure that no confidential information will be shared. It is also important for us to tell the colleague to involve the principal and other parties in planning the execution of the functional analysis, to make them more involved and make them feel a part of the assessment.
Does anybody else have any thoughts on that question?
Yeah, I do. I thought that was a great response, Jade. The only thing I would add is I would try and find out what the principal's concerns are with a functional analysis. If they think it's a time or a cost measure, there are brief functional analysis we could do where you can complete it. You can run all 4 conditions within 10 minutes. And so I would try and find the root of why they are against it. And then the second thing is I would tell them that our client is our first priority. And if a functional analysis is the best way to determine the behavior, I would try and show different examples, and it would thoroughly explain how we were going to accomplish this. Thank you.
Those were great responses, Jade and Jessica. I also think that collaborating with a school psychologist would be beneficial because they also understand applied behavior analysis, and going to them and really having someone be on our side who is in the school district to help explain to the principal would be very beneficial to the child and to those around us. Okay, question number 2. How would you explain the differences between an FBA and FA to the parent of a client who just started to receive ABA services?
So to a parent of a client who just started to receive ABA services, it is very important for them to understand the difference between the two. Both FBAs and FAs should be described in depth because they are so different. I think a lot of people get them confused just because they can be similar, but I think they're also very different just from our debate and us discussing everything that involves both of the assessments. And then describing like both of them in depth. So with an FBA, you're assessing, or the assessment is aimed to determine why the behaviors are happening the way that they are. And an FA, on the other hand, is conducted by personally exposing the individual to various stimuli to determine what specifically causes that behavior. So both of them are different, but so I guess it just depends on what is best for the client that is needing the assessment done.
I would also like to add too, when we're talking with our clients' parents, just to also keep in mind with the BACB and their code of ethics, in 3.04, it's explaining assessment results. So I think just overall assessing and explaining to parents is explaining assessment results. So stating behavior analysts explain assessment results using language and graphics, displays of data that are reasonably understandable to the client. So just assuring that whatever we are to present to the client's parents, that it is understandable for them throughout the way.
Both of those were great comments, Jade and Jenica. I would just add along with that to, as you said, Jenica, to explain things very simply. And so basically in FBA, we're more observing. We're kind of a fly on the wall. We're just writing down what we're seeing and then are trying to find patterns later. I would say in FA is we are more actively involved and are in a sense trying to provoke the behavior so we can figure out what's causing it. Obviously, there are risks with probing behaviors, but ultimately in the long run, if we can figure out the function, we'll be able to identify a more effective treatment plan quicker. Thank you.
And for our final question, do you have any personal experiences related to this topic you would like to share?
I had an experience just a few days ago, actually. I have a client, he is 6 years old, and this is in a school setting. And originally he would engage in tantrum behavior where he would scream, he would throw objects, he would punch staff, he would try to leave the room, he would yell things like, "I'm just gonna go kill myself." And initially, the teachers and my supervisor, we thought it was an escape behavior because he did not want to be at school. And so based off this information, my supervisor wrote a behavior support plan to support an escaping behavior. Over time, we found that this behavior still had a really high intensity and was still occurring pretty frequently. And so just on Wednesday, this client began engaging in that behavior I just described. And we started following the BSB, or the behavior support plan we had written, but it hadn't proven to be effective. And so finally, my supervisor and I started doing an FBA. We began taking ABC data and just writing down the antecedent, behavior, and consequence. We started looking for correlations to try and figure out what the function of behavior was. With no luck, we then moved to a functional analysis where we were probing and trying to promote different behaviors to see what the function was. Due to doing a functional analysis, we figured out that the behavior is actually access. The client, in a sense, has this learned helplessness where if he comes in contact with something that he isn't able to do, he will just shut down and start engaging in the behavior I previously mentioned. But he will also not ask for help, or he won't accept help. Instead, he wants us just to perform the behavior. So through this, we figured out that he is wanting access, but a very specific type. He wants the staff or the teacher to just complete the task for him. And the behavior of screaming and throwing is also a form of escape. And so that was really effective by really utilizing both of the different techniques, but we ultimately found the solution through a functional analysis. Thank you. All right, I'm going to stop this debate.